When your child has a dental emergency, it can be hard to know what needs immediate care and what can wait for a regular appointment. Tooth pain, a broken tooth, swelling, bleeding, or a knocked out tooth can feel scary for both the child and the parent. The most important thing is to stay calm, know the warning signs, and call a pediatric dental office right away when something seems urgent. In this video, we'll explain when kids need emergency dental care, what parents should do before reaching the dentist, and why having a pediatric dental emergency contact already identified matters. A dental emergency is any problem that needs prompt attention to relieve pain, protect a tooth, manage injury, or prevent things from getting worse. Not every dental concern is an emergency, but certain symptoms should never be ignored. If your child has severe pain, swelling, a knocked out tooth, a broken tooth, or bleeding that will not stop, it is time to contact a pediatric dental specialist right away. Severe or worsening tooth pain in kids should be taken seriously and evaluated promptly. Tooth pain can come from decay, injury, infection, or other dental problems, and is one of the most common reasons for emergency visits. Children do not always explain pain clearly and may avoid chewing on one side, wake at night, refuse foods, or resist brushing. Persistent, severe, or worsening pain means you should call the dentist and arrange for an evaluation as soon as possible. Pain is the body's way of signaling that something is wrong, and waiting too long can make treatment more complicated. A knocked out permanent tooth is one of the most time-sensitive dental emergencies for a child. If a permanent tooth is knocked out, call the dental office immediately and seek care quickly, ideally within about 30 minutes when possible. If you find the tooth, pick it up by the crown only, avoid touching the root, and keep it moist in milk or the child's saliva. Do not scrub the root, do not let the tooth dry out, and avoid storing it in a napkin where it can dry quickly. Baby teeth are different, so call your pediatric dentist for instructions rather than trying to replant a knocked-out primary tooth. Broken, chipped, or displaced teeth need evaluation because visible damage can hide deeper problems. Save any pieces of a broken tooth if you can, place them in a container, and bring them to the appointment. If a tooth is pushed inward, outward, or is loose after trauma, a pediatric dentist should evaluate it right away. Swelling around the gums, jaw, cheek, or face can indicate infection or serious injury and should be taken seriously. If swelling is accompanied by fever, trouble breathing, difficulty swallowing, or spreading redness, seek emergency care right away. Uncontrolled bleeding from the mouth that does not stop after 10 to 15 minutes of direct pressure requires immediate attention. Facial trauma involving the mouth or teeth, or injuries from sports and falls should prompt a prompt call to your pediatric dentist or emergency services if severe. Chestnut Dental offers 24-hour emergency call coverage with board-certified pediatric dentists, so identify your emergency contact ahead of time. Before you reach the office, keep your child calm, control bleeding with gentle pressure, and collect any tooth fragments or relevant information. If you are unsure whether a situation is urgent, call your pediatric dental office and describe the symptoms so they can advise you on next steps. Having an emergency plan, knowing your pediatric dentist's contact, and acting quickly when warning signs appear can protect your child and improve outcomes. If you have questions or need emergency dental care, contact Chestnut Dental at our Needham, Franklin, or Bedford locations for guidance from board-certified pediatric dentists. Stay calm, trust your instincts, and call a pediatric dental specialist when symptoms like severe pain, swelling, a knocked-out tooth, a broken tooth, or uncontrolled bleeding occur.